Imagine having a family of 4, and because of Obamacare, between the years of 2014 and 2022, your health insurance will increase by over $7,000. My name is Caelin Campbell, and today I'm going to present to you on how Obamacare affects the average American household. I'm going to start talking to you today about what Obamacare is, explain it in a little more depth. Explain why most Americans cannot afford it. As well, I'm going to talk about how it affects large and small businesses. Obamacare was signed in 2010 by President Obama as a health reform. It's also referred to as the Affordable Care Act. Obamacare's primary goals are to reform the healthcare industry, reduce healthcare industry costs for the United States, and provide more Americans with health insurance. Obamacare presents many young, healthy Americans with the dilemma to either pay higher monthly insurance premiums or run the risk of having to shell thousands more in deductibles in healthcare if you get sick. Now we're going to look at how it affects the individual. Insurance premiums are looking to increase by 99% for young men. That's what I found from the Manhattan Institute, where they compared insurance premiums before Obamacare and insurance premiums after Obamacare. Some Americans think that it is unethical not to provide every American with insurance, but I think it's unethical to make a young man pay more than double in insurance premiums. As well, young women have an increase of 62%, and the average for Americans is 24%. Obamacare is also negatively affecting large businesses. Large businesses, in response to Obamacare, are having to cut hours to avoid paying benefits. Many of these restaurants I listed above, you've probably eaten at. So you're probably thinking, how does this affect the average American household? All these companies have about 400,000 employees, and now these employees may not have benefits because of Obamacare. It also affects small businesses. I came across a small business in North Georgia where they ran a boutique and they sold homemade strawberry jam. Obamacare has negatively affected them because before Obamacare, they were able to insure 18 full-time employees. But after Obamacare, with its policies, Obamacare forced them to have to go from 18 people to insure to 200 because they had 400 temporary employees, and Obamacare looked at the number of hours the 400 temporary employees had, and that resulted in them having to pay for 200 people. Obviously, a small business can't afford to insure 200 people, especially the gap from 18 to 200. So, as a result, this small business is going to have to pay a fine of $2,000 per employee, which, if you look at it yearly perspective, that's going to be a $400,000 increase in expense to that company, rather than an estimated $2 million cost increase if they would have to pay insurance for all 200 employees. And the small business simply doesn't have the funds to pay $2 million. This affects many average American households because there's over 27 million small businesses in the United States. Small businesses are often referred to as the backbone of our economy. As well, small businesses have resulted in 64% of the new net jobs between the years of 1993 and 2011. If small businesses are affected by Obamacare, we really need to reconsider the policy. as you can see from the graph, there's going to be a huge discrepancy in the increase from 2013 to 2014 because Obamacare is going to take into effect January of 2014. There's an over $500 difference between 2013 and 2014. Obamacare is really increasing the spending per family of four. There's also many other concerns with Obamacare because, like I said, there's an estimated 40 million people, 40 million Americans who now will have the opportunity to have insurance. So that presents more problems, such as doctor shortages and longer wait times. In my research, I came across other countries who have health care and health insurance, and what I found is, especially in Rwanda and Thailand, is some of the main problems is that they've experienced doctor shortages, and they also have experienced that the doctors haven't been able to provide the right type of care because they have too many patients to care for. As well, the ER wait times are ridiculous. They're way too high. As well, as I talked about earlier, the elimination of insurance benefits in response to Obamacare, many small and large businesses are having to do this because Obamacare's insurance premiums and rates are going too high that they have to cut costs. As well, as I talked about earlier, there's an estimated 40 million Americans who now have the opportunity to have insurance. A lot of these Americans this will be the first time that they've had insurance, and a lot of them will probably be pretty uninformed because they've never had insurance to begin with. So they might not be able to fully take advantage of all the benefits of Obamacare. Before I go into my conclusion, I wanted to show you a map that really gets a closer look at how it affects each state.
Our business is investment.
This site allows you to look at states individually and see how it will increase your premiums. For example, I want to look at New Mexico. As you can see, for a 27-year-old, there's going to be a 146% increase. As well, for a 40-year-old, there could be a 94% increase. Again, what this study did is they compared the cheapest insurance premium before Obamacare with the cheapest insurance premium after Obamacare. And then they compared it so that they're on even ground. And as you can see, Obamacare was supposed to reduce spending, but it's actually going to increase spending for the individual and on a national level. Like I talked about earlier, Obamacare is going to increase insurance premiums for American families. As I said, from 2014 to 2022, there could be an estimated $7,000 increase for American families with health insurance. As well, in response to Obamacare, many small and large companies are going to have to cut employee benefits because they simply have to cut costs. As well, some countries who have already had universal health care and have had many problems, including doctor shortages and longer waits. And that's something we probably will incur as well. Any questions?
Is there a reason to pick New Mexico?
No, that map actually, it's not fully developed. They only have 13 states. And I picked New Mexico because that's one of the closer states that they fully had developed to Georgia. So I thought it would be a closer impact than New York.
I was just curious.